foods and liquids that help reflux. Cheese, wine, chocolate, coffee, bacon. This combination of delightful delectables will probably bring a smile to most people, but unfortunately, it can also bring a lot of discomfort. Acid reflux is a surprisingly common occurrence, especially with older populations, and the short list of foods I just mentioned are all contributing culprits to this condition. The problem with acid reflux is much larger than discomfort in your chest or throat. Chronic reflux can also lead to more serious diseases like Barrett's esophagus, which can lead to cancer. This doesn't mean you have to cut out everything you love when it comes to food and drinks, but there are ways to reduce the occurrence of reflux. That's exactly what I want to talk about today. Let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. First, let's talk about some specific foods that can exacerbate reflux. If you will think back to high school or college chemistry, you probably remember learning about pH levels. pH levels are measured on a scale of 0 to 14. 7 is in the middle, not too acidic and not too base. Anything with a pH of 0 to 6 is acidic. We eat a lot of acidic foods in the US, mainly as a result of how we process and preserve our foods. Along with canned and preserved food items with an acidic pH, foods that are spicy, citrus fruits, tomatoes, onions, cheese, and things like coffee, chocolate, and alcohol can all be the cause of heartburn. It's important to identify whether the reflux is caused by specific foods and if they are exacerbating chronic conditions such as GERD or LPRD. Of course, it's easy to say, we'll just stay away from those foods then. But sometimes we know that's easier said than done, especially when we truly love those foods or they are a part of our cultural makeup. Now that you know some foods that might be exacerbating your reflux, let's talk about some that might make things better. According to Johns Hopkins Medicine, some foods that can help prevent reflux include whole grains such as oatmeal, couscous, and brown rice, root vegetables such as sweet potatoes, carrots, and beets, and green vegetables such as asparagus, broccoli, and green beans. Additionally, bananas, melons, cauliflower, fennel, nuts, celery, cucumbers, lettuce, watermelon, broth-based soups, herbal teas, milk, ginger, and apple cider vinegar can all help to decrease reflux. One nursing home that I worked at a few years back actually had a reflux diet option that the dietary manager put together. It was optional for patients if they wanted to choose, but I thought it was so nice for the patients. It limited the main culprits that exacerbate reflux and offered foods at each meal that can help. Thought this was such an awesome interdisciplinary plan to help out the patients with a condition that occurs rather frequently. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Also, do you have any specific questions about foods and liquids that help with reflux? Leave a comment below and tell me about it. We'll be sure to get your questions answered as soon as possible. Point number 2, medication and supplements that can help. Anyone that has suffered from acid reflux understands how painful it can be. You might be desperate for relief that might take longer than you're willing to wait from, say, diet modification. Now, supplements and medications are 100% up to you and your doctor to see if they might provide some relief. I want to discuss a fairly new product to the market. I have no disclosures to make about this product other than I was a loyal paying customer all throughout my pregnancy. Reflux Gourmet is a product that uses Alginate Therapy, which is a polymer harvested from seaweed and kelp. According to Reflux Gourmet, their clinical studies have shown alginate can be more effective in treating reflux than prescription medication that may come with side effects. In addition to relieving the pain of reflux, alginate therapy usually stops reflux from happening as it forms a protective coating in your throat, esophagus, and stomach that can help relieve or prevent reflux. This product is just like a tube of toothpaste, and you take a little spoonful as reflux symptoms arise. I kept that tube next to my bed, I forewet the spoon, and I squeezed it right into my mouth rather frequently at night during pregnancy. Now, for some people, they may opt to choose either an over-the-counter or prescription medication to manage their reflux. These statements do not constitute medical advice, and it's always most important to communicate with your doctor or pharmacist before starting any new medication. H2 blockers, which stand for histamine blockers, are some of the more common drugs that we're used to hearing about, such as Pepcid, Tagamet, or famotidine. These can reduce the amount of stomach acid released by glands into the lining of your stomach. Many people take these over the counter as they provide immediate relief, but they can come with many other unwanted side effects. The next group of prescription drugs are called PPIs, which are proton pump inhibitors. They include common names like Nexium, Prilosec, Prevacid. PPIs can be very beneficial for certain populations and conditions, but also can come with some very strong side effects. This is most definitely a conversation you need to have with your physician or pharmacist before starting a PPI regimen. I know personally in my family, we have different family members managing GERD in a variety of ways. Some make diet modifications, some take the Alginate, some are on H2 blockers, and some are on a PPI. What I've learned all about studying reflux and its impact on swallowing, and depending on other comorbidities and drug interactions, is that the way you manage reflux is completely individual, and a conversation that is only to be had between the patient and the physician. I know I've seen too many times SLPs will recommend a specific regimen, and I don't think that's our place, nor is it within our scope of practice to recommend drugs to patients. Discussing diet modifications and educating them on the various supplements and medications available is fine, but we need to be mindful not to push a specific protocol that really is out of our scope. Lastly, I want to suggest some books that are really super detailed in this area if you're wanting to learn more about where reflux comes from, what it can cause, and how to make some lifestyle and dietary modifications to improve. Dr. Jamie Kaufman wrote a book called Dropping Acid, The Reflux Diet Cookbook and Cure. She also has a cookbook on the topic as well. Dr. Jonathan Aviv has written a few different books on this topic as well, including The Acid Watcher Diet and an accompanying cookbook. I have no incentive in sharing these books with you. They are just written by experts in the field and provide really insightful and easy to read information. I remember when I was pregnant, I was looking for any sort of relief to my reflux, as I'm sure so many people have. And I was so grateful to have found the Reflux Gourmet Alginate, but I also dove into Dr. Aviv's book too and learned some really helpful tips. One of the things he recommends is drinking water with cucumber and watermelon in it, which can soothe the throat and act as an anti-inflammatory. I just love learning about being able to use different foods as medicine, which is one of Dr. Aviv's key taglines. Check out episode 12 of the Swallow Your Pride podcast, where I chat with Dr. Aviv about reflux and different ways to manage it. You can check out the links in the description below.